Hello guys, what's up? This is Dr. Rob, and today I'm going to show you my top exercises I have for SI joint pain for my patients. So today I'm going to walk you through a little bit of the exercises I do with my patients that have pain in their SI joint, which is very common amongst people with back pain, and I'll show you where I start out. All right, so the first one I typically do is just balancing out the pelvis. So what that means with SI joint pain, typically people that have it there have issues with is where your tailbone connects into your iliums, which is your pelvis. So sometimes that tailbone needs to be glided a little bit against your pelvis either way to help things even out. So the first group of exercises I'm going to do are meant to get that movement and also to stabilize your pelvis a little bit. So let me show you what I'm talking about. I'm going to lay down here like this. And I'm going to put this knee, and I'm going to push up towards my chest. And with this knee, I'm going to push down the opposite direction. So I'm just resisting myself as I push up with one and down with the other. So we're going to hold that for 10 seconds. And you're going to switch hands, and you're going to push down with the other one and up with the other one. So you're just resisting the force that you're creating, okay? So if you can imagine, what that's doing is it's taking my pelvis and rotating it a little bit on my SI joint. And I'm getting a little bit of flexibility and stretch using the muscles of my pelvis. All right, so that's number one. The second one we're going to do to balance that out is taking a ball or something between your knees and just pushing inwards. So you're here and you're just going to push together. And by squeezing, you're going to feel a lot of tension in your groin. That's stabilizing what we just did to mobilize your pelvis a little bit. So we're going to hold that. Once again, everything is 10-second holds. And then you can put your hands here, put the ball away, and you're going to push out against your hands. So you feel that force now pushing out, and we're stabilizing outwards. So using your own muscles to create the stability that you just mobilized by doing the push-pull exercise, okay? So once again, 10-second hold going in, and 10-second hold pushing out. With all these exercises, we're going to try to do 3 rounds of all of them, going push-pull, that's 1 rep, push-pull, that's 2 reps. We're going to do 10 reps of that, and then you're going to do 10-second holds going in, and 10-second holds going out, and we're going to do 10 rounds of that. So we're going to work through all 3 of those motions 10 times, and then we'll move on to our next set of exercises. For this next round of stretches, I'm going to show you the half kneeling hip flexor stretch. It's a common one that I do with a lot of patients. Your hip flexors originate, at least your iliacus and psoas, your iliopsoas, originate from the front of your lumbar spine. So by stretching that muscle, we can relieve some of the tension in your low back, which in turn helps people with their SI joint pain. So if I'm half kneeling here and I lean forward while squeezing my butt cheek, you're going to get a big stretch in this area right there. All right, so we're stretching the muscles that go right between your lower back and your pelvis and your femur. So you're going to push forward and hold that stretch. Push, 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 10-second hold. Squeeze your butt and then relax, and you're going to go a little further, okay? The goal here is making sure that you're not arching your back as you're coming forward. You're going to squeeze your butt and lock your pelvis down and keep your lower back flat, and then just push your knee forward. So as you push your knee forward, you're going to feel that stretch develop in the front of that thigh, okay? Any stretch, you're going to hold 30 to 45 seconds. You can do 2 to 3 rounds of that. And the overpressure, what I was talking about when you're squeezing your butt and pushing really hard, you can literally lean into it. You can do that for about 10 seconds. And you can relax and go a little further and do another 30 seconds. All right? So that's a half kneeling hip flexor stretch. Another great one that you can do after that would be the quadruped hip dips. So you can be on all fours. Looks like this. And now we're going to move our pelvis in this direction. So we're going to move in the plane of forward and back. So as you're here, I'm going to have you all fours, and you're just going to slide your hip up and down. You're just raising your knee off the ground a little bit, like you're going to put a piece of paper underneath your kneecap. So as you come up, you're feeling that rotation within your pelvis. So we're getting a little bit of mobility, but at the same time, you're controlling the motion very well. All right, so it's a body weight loaded exercise that's going to be working mainly the opposite glute. So my left leg, that glute muscle here, is helping take my pelvis and rotate it. And when I'm doing that, I'm creating stability, but also gaining new ranges that I typically probably am not hitting if I have this lumbopelvic pain, okay? So we're gonna do about 10 to 15 on each side, and just gonna rotate up and through that motion on each side, okay? So once again, the other side to be pulling up like that, and we're getting a little bit of rotation at the pelvis. Finally, another one to anchor in some of our gains today is a side plank. So the side plank, we can make enhanced with a band. So if you have a band, it's even better. But we are trying to create stability all the way from the bottom of our rib cage through our lumbar spine into our pelvis and our legs. So we've always used side planks as a way to gain abs. You've done these before and they suck, right? But now we're just gonna go from our knees a little bit easier. You're gonna squeeze your butt, line up your elbow, your hip, and your knee in one line, and come straight up like this, okay? So by holding this position, it's a way to actually strengthen our core. So we're locking things down in neutral while also working our glutes, right? And those glutes originate in the same area as our SI joint. So as you're coming up, you can also enhance it by putting a band around your knee, coming up and rotating out at the same time and holding that position. Once again, it's an isometric exercise, so I recommend 30 to 45 second holds. You can do about 5 rounds of these pushing out as you're holding that, okay? And come back down. All right, so once again, hold it. You can do both sides, 5 rounds, 30 to 45 second holds, and just maintain that position at the end of this workout, and you're gonna strengthen your hips pushing outwardly, okay? And finally, a bonus exercise that you can do, it'll be very beneficial for you, is putting the band around your ankle, putting the ball between your knee, and now we're gonna work into internal rotation of your hip. So if your knee is bent, you're holding the same position we just did, a side plank, and you're pushing out against the band, rotating. You're gonna feel in a different part of your hip, because now we're working on the internal rotators of your hip. And by maintaining this position, you're stabilizing your pelvis and working on the internal rotators, which originate from your SI joint. So once again, we're working on the things that matter, that contribute to what you're feeling in this SI joint pain. Once again, 30 to 45 second holds, 3 to 4 rounds. Oh, I'm sweating myself. So once again, work through all those exercises 1 to 2 times a day. Give it a few days of attempts, and I swear to you, you're gonna feel some relief in your SI joint pain. Thank you very much. This has been Dr. Rob Polzuk with Physiologics Physical Therapy. You can DM me or reach out to me here at Dr. Rob Polzuk on Instagram.